In medicine and money, Mir Scientific has developed a breakthrough technology. It's a test that will detect, classify, and monitor prostate cancer. Joining us now is Salman, CEO and founder of Mir Scientific. Good to have you here. Explain what makes this a breakthrough, and will it be a money saver?
So the opportunity to innovate and save money, and of course, most importantly, improve outcomes, was very compelling. And from our point of view, we had an opportunity to innovate to achieve three things. First is that the majority of men who should be screened because of their age are not. So around 40% of men are the ones who actually go in and get this test and engage with their doctors to determine whether they have a risk of prostate cancer. 60% do not. So just imagine from a business and economic point of view, that's a big opportunity. It's also a big opportunity because those men, when they finally engage with the healthcare system, are coming and showing up with disease. It's no longer the opportunity to early detect their disease has gone. And that's, as we know, not a good thing. The second thing is none of these tests are able at the beginning of the process to be able to determine definitively determine whether a patient has cancer, and if so, is it low risk, intermediate risk, or high risk. And that really determines how the treatment and the next steps of that patient should be managed. So we combined all of this, and we created a platform that's entirely urine-based, so non-invasive. It is very accurate, as we have published in the Journal of Urology, which is a leading peer-reviewed publication, what we consider to be very breakthrough results that are industry-leading in terms of accuracy, well over 90%. And that test, our test from urine, is able to say whether or not there's cancer, and secondly, and importantly, whether that cancer is low risk, intermediate risk, or high risk, and as a result, what they should be able to do next from a clinical point of view.
This test is actually easy. How are you working towards making this test as available as possible to all men?
We're very much working with all kinds of stakeholders, Angela, including doctors and hospitals, employers, and other community and advocacy groups, to be able to firstly increase awareness of the importance of screening and being proactive and being able to, just for men to engage with the healthcare system, and as a encouraging inducement or incentive that they can do so without the burden and risks of the current procedures. So we're working with multiple stakeholders. Ideally, a patient would go to a doctor and ask for the test during their annual checkup, or if there is a suspicion of disease, their specialist and urologist would first give them this test prior to biopsy. And we believe that that would cause both improved outcomes medically, and of course, by virtue of eliminating many steps, many of which are unnecessary from the point of view of the patient's well-being, we save money for the healthcare system, and certainly save money in terms of out-of-cost expense and potential complications financially for patients and their families.
Fascinating to have you here. Thanks again.
Thank you so much, Angela. It's great connecting with you and your audience. And if anyone wants to learn more, they can visit our website on mirscientific.com, MIR Scientific, and we'll be delighted to share what we've done with them.
For more Business First AM, check us out on social media. We're on Facebook, YouTube, and Twitter. And go to businessfirstam.com for where to see our show on TV.